This is a go-to program for students who want an excellent clinical experience.
I think the RIDE program, it's an awesome program. It's a very unique program.
I'm hoping that I'll go back and work for my tribe, the Yakima Nation.
It's a win-win situation for the students, for the school, for the state, really, and the community.
I think it's one of the best programs on earth.
The University of Washington School of Dentistry has developed a unique program called RIDE.
RIDE stands for Regional Initiatives in Dental Education.
Dr. Wendy Moradian has been the driving force behind the RIDE program. It began with a clear goal: to make dental care more accessible in Washington State.
RIDE is a mission-driven program. It's to distribute the workforce to rural and underserved areas. And we had 40 years worth of a successful program in the medical school of putting out physicians into the other areas, the rural areas and underserved areas.
You've only got a butt joint and a butt.
RIDE is a highly selective program for a reason.
And this, I think, is the secret to success. You don't do this by accident. You intentionally choose the students, then you provide the education that sets them up for it, and then you actually allow them to participate and work in those areas and see the practice opportunities.
It's really been a big success. Can you show me the thing with the partial?
Dr. Frank Roberts is the RIDE director at the UW School of Dentistry.
The RIDE program basically allows dental students to start their first year of dental school in Spokane. They spend their first year there taking kind of the basic classes, the basic dental classes, the basic science classes. Then they all come back to Seattle and do their second and third and part of their fourth year in Seattle.
To see how the program works, you go to the River Point campus in Spokane.
My background is in biochemistry and molecular biology.
It's an academic hub run by RIDE's educational partners, Eastern Washington University and Washington State University.
This is a wonderful opportunity that the RIDE students have. They're able to be in a campus with a small number of medical students, so they're able to interact with those students. They interact with dental hygiene students, and they even have sessions that also involve pharmacy and nursing students.
How's it working?
Dental faculty in Spokane teach many of the courses, but students also stay closely connected to Seattle with cutting-edge technology.
My primary function is with RIDE, which is a distance education program. So the idea is to connect them with educational technologies to classes that are ongoing here at the University of Washington.
Depending on the size of the protein,
We build a bridge via video conferencing or recorded lecture materials to stay in touch with them and to attend classes that are actually ongoing in real time here on the University of Washington campus.
Distance learning really makes this whole thing possible because financially it wouldn't be feasible to put this together just for 8 students. So that technology is invaluable.
If you have just an absolute button.
Dr. Art DeMarco, Spokane director of RIDE, believes this program attracts a certain kind of student.
They are students that have a passion for doing this, for being in a program like this that does serve the needs of the underserved. And they are wonderful. They are also independent learners. They become an amazing team while they're here, interacting, helping each other. At the same time, they're all capable of doing it by themselves.
This isn't a place to come and relax, no. But it's a place that we want them to have fun learning. So what you'd like to do is you'd like to just release it a little bit. I think it's so valuable because number one, we get the students who really want to learn, and they are basically interested in helping in these rural and underserved areas. About that much right for the interference so you can feel it.
I think it has a lot of appeal for students from diverse backgrounds. I think they see this as a mission-driven program. They see this as a program that will give them the skills to go back and serve their communities.
The RIDE program is meant to serve underserved and underrepresented communities, and I am from one of those communities. So for me, always wanting to serve my community and giving back, when I found out about the RIDE program and their mission, I figured that I'm a perfect fit for that program.
promoting healthcare in underserved, underprivileged populations and targeting Eastern Washington. I just felt like it was in line with my goals and mission in life, and so coming from the Yakima Indian Reservation, that's where I decided I needed to be in the RIDE program.
I think that it's very important to, in at least healthcare or really anything, help where it's needed. And right now, rural areas just don't get the service that they need.
Use your perio probe.
RIDE students get real-world training during their community rotations after their first year and later during their fourth year.
The clinical rotations are the piece that really makes it very unique, because the students go out for a month between first and second years, get to know the communities, get to know the clinics, understand what community health is all about. Then they spend 4 to 5 months in their fourth year actually providing care in these clinics.
There's definitely a shortage of dentists on this side of the state, so being able to serve those populations is very rewarding. I'm Ryan LeClaire. I'm a fourth-year dental student at University of Washington in the RIDE program.
Ryan LeClaire works with his preceptor, Dr. Brian McCall, at Spokane's Unify Clinic.
It's been wonderful to be here with Dr. McCall. We've been able to develop a good working kind of mentor relationship.
It's a good one-on-one experience, and it's a lot of good mentoring that I've done with them over the past 4 months.
So right there.
Our population consists of very poor people, to middle-class people, to refugees, to all different nationalities.
We really take pride in treating our patients here like any other patient. I think sometimes in our society there's a stigma associated with community health. We really try and make sure every patient that comes in these doors is treated with the dignity and respect that they deserve.
RIDE students not only see a variety of patients, but also a higher volume of patients.
When they go into these external rotations during their fourth year, they're seeing usually between 6 and 12 patients a day, which is about double, triple, quadruple the number of patients that the students see here in a regular day during that part of the fourth year. So it's very intensive.
You get to see so many different medical histories. You really get prepared for what can come through the door and the kind of complex cases that you can see.
According to Dr. Muradian, for some RIDE students, this program plants a seed for service that grows beyond graduation.
And many of them return. Many of our students are working in community health centers or in rural and underserved areas in Washington, but also the region.
I hope to be able to work in a community clinic and have an impact in a smaller community.
Once I graduate, work at a federally funded clinic, because all my dental care when I was younger was at one of those clinics, and all my families are getting care from there.
The RIDE program is attracting national attention as a model for community-based educational experiences. As the need for oral health rises among the vulnerable, RIDE continues to define its mission to provide quality dental care to rural and underserved areas. And clearly, that mission is making a difference.
It's changing lives when we change smiles, when we create a nice smile so that someone can be more successful in life. It makes an incredible difference.
To see that what skill you're developing is actually going to contribute to somebody's health, that is so rewarding and so reinforcing. I think it's very important for students to have that experience early, and so that embeds in their mind the notion of, wow, this is why I went into dentistry, to help people.